If you take vitamin B12 every single morning, stop and watch this before you take your next dose. Because right now, what you are doing to protect your health could actually be putting your heart and your brain at serious risk, especially if you are over 60 and taking certain very common medications. This is not a warning against B12. B12 is essential. The problem is the combination, and it is a combination that millions of seniors are unknowingly taking every day. I am Dr. William, and this video could be the most important thing you watch this week. Please share it with every senior in your family, because what I am about to explain affects anyone over 60 who takes vitamin B12 alongside two of the most commonly prescribed medications in the world. Let me start with why B12 matters so much after 60. Vitamin B12 is essential for three critical functions: the production of red blood cells, the maintenance of your nervous system, and the repair of DNA. After age 60, absorption of B12 from food declines dramatically because the stomach lining produces less of a protein called intrinsic factor, which is required to absorb B12 from what you eat. This is why B12 deficiency becomes so common with age. Deficiency causes fatigue, memory problems, tingling in the hands and feet, and, left untreated, can lead to irreversible nerve damage. So B12 supplementation after 60 is often genuinely important. The issue is not the B12 itself. The issue is what happens when B12 is combined with specific medications and how that interaction affects a critical biochemical process involving a compound called homocysteine. Here is the science you need to understand. When B12 is metabolized properly in the body, it works with folate and B6 to convert a harmful amino acid called homocysteine into methionine, a benign and useful compound. Homocysteine, when it accumulates, is toxic to blood vessel walls. High homocysteine is now recognized as an independent risk factor for heart attack, stroke, and dementia. In fact, research published in the New England Journal of Medicine found that elevated homocysteine can increase the risk of stroke by up to 80%. B12 is supposed to keep homocysteine low, and in most healthy people, it does exactly that. The problem emerges with two specific medications. The first medication is metformin, the most commonly prescribed type 2 diabetes medication in the world. Metformin has a well-documented effect on B12 that most patients are never told about. It significantly reduces B12 absorption. Studies show that between 10 and 30% of long-term metformin users develop B12 deficiency. This happens because metformin alters the calcium-dependent binding of the B12 intrinsic factor complex in the small intestine, blocking absorption. If you take high-dose B12 alongside metformin, some of the B12 is absorbed, but not in a consistent or predictable way. The problem is that when absorption is irregular, homocysteine levels can fluctuate dangerously. You may think you are protected because you are taking B12, while your homocysteine is actually spiking on the days absorption is poor. The second medication is a class of drugs called proton pump inhibitors, PPIs. These include omeprazole, lansoprazole, and pantoprazole, medications taken daily by tens of millions of seniors for acid reflux, GERD, and stomach protection. PPIs dramatically reduce stomach acid. This matters enormously because stomach acid is required to release B12 from food, and it also plays a role in the early stages of B12 metabolism. Long-term PPI use, particularly at high doses, has been associated with a 65% increased risk of B12 deficiency, according to a study published in JAMA. Again, if you are taking supplemental B12 alongside a PPI, you may be getting inconsistent absorption, creating unpredictable gaps in your homocysteine protection. Now, here is where the danger becomes acute. If you are taking both metformin and a PPI, which many seniors with diabetes and digestive issues do, the combined effect on B12 absorption can be severe. And if your B12 level drops enough that homocysteine rises, you become significantly more vulnerable to cardiovascular events. What should you do if you are in this situation? First, get your B12 blood level tested. Not just B12 in serum, but also homocysteine and methylmalonic acid, which are more sensitive markers of functional B12 deficiency. Second, talk to your doctor about switching from oral B12 to sublingual or intramuscular B12. Sublingual B12, the kind that dissolves under the tongue, bypasses the gut absorption pathway entirely and enters the bloodstream directly. This largely eliminates the interaction with both metformin and PPIs. Intramuscular injections are even more reliable and are standard treatment for confirmed B12 deficiency in people on these medications. Third, consider the timing of your supplements relative to your medications. While not a complete fix, Taking B12 at a different time of day from your metformin or PPI can reduce direct interference. Many integrated practitioners recommend taking B12 first thing in the morning on an empty stomach, well before morning medications. Fourth, be aware of the symptoms of B12 deficiency so you can catch it early. Unusual fatigue, numbness or tingling in the hands or feet, difficulty concentrating, mood changes, balance problems. These symptoms overlap with many other conditions, which is why B12 deficiency is routinely missed until the damage has already occurred. I want to be absolutely clear. This is not a reason to stop taking metformin or PPI. These are important medications. This is about making sure that if you take them, you are also protecting yourself from their nutrient interactions, which very few doctors proactively discuss with their patients. The bottom line is this: if you are over 60, taking vitamin B12, and on either metformin or a proton pump inhibitor, please schedule a conversation with your doctor this week. Ask for homocysteine and methylmalonic acid testing. Ask about sublingual or injectable B12. Ask whether your current B12 dose is achieving actual absorption, not just theoretical coverage. Your heart, your brain, and your nervous system are depending on you to ask that question. Share this video with every friend and family member over 60 who takes B12 supplements, because the interaction I described today is almost never mentioned on the label and almost never discussed at the pharmacy counter. The information you now have could genuinely make a difference